Hello, welcome to Heroes for Oral Health, a podcast focusing on the different heroes that affect the lives of several others every day in the oral health space. Today, we are speaking with Dan Garrick, Vice Chair of the DTA Foundation Board and the Chair of the Grants Committee. Dan Garrick works for Young Innovations. Welcome, Dan, and thank you for joining us.
Good morning, Sarah. Thanks for having me.
So, Dan, what were your initial thoughts when you were asked to join the DTA Foundation Board?
Yeah, great question, Sarah. So I had admired the work of the DTA Foundation for several years. I was at a DTA annual meeting, and Kevin Thomas and some of the other board members were up on stage explaining the work of the foundation, talking about some of the successes and challenges that they'd had. And I just really thought, this is a phenomenal body. This is a group of people doing great work. And, the need has to be there. And 2 years later, I was asked to join, and just really felt honored to be able to be part of the great work and be able to give back to dentistry and the dental community, which has been a huge part of my life over the last 21 years here.
And you also were asked to be the Grants Committee Chair, and you've been a chair for a little bit now. What have been your observations, and what have you seen as that Grants Committee Chair?
Sarah, I think that I served for a couple of years on the committee reviewing grants, and the difference between being on the committee and being the chair is really the number of proposals you see and the amount of guidance and leadership that you need to provide. When you read through hundreds of grant proposals, as I have and others have over the last few years, it highlights the incredible unmet need for both professional and oral home care in the United States. Those of us who are in the industry, we understand what we need to do, how often we need to go to see dentists and hygienists and endodontists and orthodontists and all the great providers. But those that aren't really don't see it. And there's just amazing number of barriers to care. Fewer than 50% of Americans are seeing the dentist or going to a dental practice on a yearly basis. And there's just a really wide array of barriers stopping people from doing that. And then when you read through these grants, it really highlights, and it can be emotionally difficult and troubling to read through, hearing about veteran and pregnant teens and special needs people from all over the spectrum that really have trouble accessing care, but also just regular Americans who can't find time, or they have language barriers or cultural barriers from accessing professional care. The flip side of that sort of depressing landscape that you see is that there's unbelievable engagement. First of all, there's a patchwork quilt, unfortunately not very organized, patchwork quilt of organizations trying to meet this need and clear those barriers. Everything from public health officials to nonprofits to individual dentists or concerned people or organizations, academicians and others. What you do see is that they are all accessing the amazing engagement, dedication from professional oral healthcare providers. Everyone from assistants, hygienists, dentists, specialists, give back, engage in the communities. The industry does as well, provide free care, education, consulting. They're motivated, they're operating with drive, dedication, and purpose. And that's the part that kind of brings you back to, wow, this is a great group of people trying to do the best they can for the population here in the US. And, the organizations are finding amazing and creative ways to overcome barriers to care and improve access to care. So, the average patient who's not going in might have an emotional barrier. They might be afraid or be anxious. But there's also, as I referenced a little bit earlier, cultural norms. Some people, especially from other countries or parts of this country where oral healthcare is not normal, they just don't go to the dentist. It's only something you do when, you have bleeding or incredible pain or it's time to have a tooth extracted. They don't see it as a normal part of preventive healthcare. There might be language barriers for people accessing care, or basic barriers like transportation and logistics. And then the really heartbreaking barriers to care are people with special needs, patients who are homebound, certain geriatric patients. Those are the stories, when we fund people that help those folks out, those are the stories that always make me tear up and cry during the foundation videos that we show on, our website and social media and at our Dental Trade Alliance meetings on an annual basis. And those are they're heartbreaking, but by the same token, we're able to make a difference there. I think some of the other things that I've seen over the last few years is that our grantees have been able to leverage digital technology, whether it's apps or other digital technologies, to provide better access to care and providing care for people directly. Teledentistry is a great example of that, and one that has become increasingly relevant in the current period with the massive infection prevention challenge of the COVID-19 virus. So dentists now are able to provide teledentistry care to a certain extent. And part of that, I really do believe, has come from some of the programs that the DTA Foundation has funded over the years with teledentistry and some of the related challenges and solutions that people have found. On a go-forward basis, and Sarah, you and I and the board have talked about this, with the COVID-19 crisis, clearly there is going to be a much greater amount of unmet need. There's far more people who are going to be unemployed or are unemployed, who are going to have financial challenges with accessing care. You know, the Dental Trade Alliance will lobby on the Hill for increased benefits for people. They'll work with state organizations, et cetera. But the foundation as well, we're working at this time to figure out how to pivot our focus and redirect our funding to tackle immediate needs in a different way. And also, the dental provider is facing an unprecedented challenge. The recognition that aerosols, which are produced in many dental procedures, are going to present a really unique challenge with this really virulent and destructive virus. So there's going to be new processes and procedures, a need for new deployment of PPE, and all those things that, you know, much of the country now knows about. We didn't know about these things 3 to 6 months ago. The dental industry and the dental market did, but there's a new level of severity to the problem, and we need to help providers tackle this challenge as well. So I think we've got a lot of challenges in front of us, but having seen what our grantees and what our organization has been able to do, I think we'll find a way to be a really engaged and important solution provider for both patients and for oral healthcare providers.
Yeah, and you are a very active and engaged board member. So not even just with the grants, you're also active with forward direction and, you know, helping solve some of these challenging issues foundation-wide. So how do you juggle time between business, family, board responsibilities, and everything else you do?
Well, thanks, Sarah. I think, like most busy people, not particularly well, to be honest. I think that what I do is what many people do. There are many weeks of way too much work and travel and focus on responsibilities and passions outside the home, and then just trying to find some time to decompress and connect with my family and other loved ones. So for me, it tends to be more of a cyclical situation where, you know, my family has been willing to put up with me traveling over a 2-week period and spending a lot of time outside of the home, and then try to find my way back in and connect with the family. I have a very supportive wife who helps keep everything in perspective and tells me when I need to spend more time at home and what I need to do. And, you know, that's great. And I have a very supportive CEO who encourages us in our company to take time with our families. We work very hard on our business, connecting with customers, aggressively growing it, et cetera. But he also is adamant that we need to spend time with our families and our loved ones. That's why we're doing what we're doing. But in all of this, what I would say is that, you know, the benefit that I have, the benefit of being in this industry and making the products that we make and selling what we sell, is that our company's products are an integral part of what clinicians use every day of their armamentarium, especially for dental hygienists who are so important to not just provide great clinical care, but they also make patients feel comfortable in the chair. They reduce their anxiety. They promote better home care. So I think it's an element of luck where I'm able to, you know, do things that I think are really of benefit to society, and at the same time, you know, are a way that I make a living and have challenges and excitement and leadership opportunities. So I don't think that I necessarily balance things out particularly well, but I think I'm able to maintain a pretty decent mental equilibrium and emotional stability, because what I'm doing on the board, in the company, et cetera, is something that is important for society. And I think my family and loved ones recognize that.
Yeah, and we appreciate, of course, all the time you spend with us and all that you do and the support of not just you, but also your company. And so I wanted to ask one last question before we go. I wanted to ask, what are you most passionate about with your work on the foundation board?
Yeah, thanks, Sarah. And one of the things I should have said when I was answering your question before was, of course, it's also a pleasure to work with you, Sarah, and with Laura and other members of the staff at DTA and with you guys in the DTA Foundation. And you make life a lot easier and better and keep us organized and focused. But going back to your question about passion and the foundation board, I'm a huge believer in this foundation and what we do. And I've served on other volunteer and charity organization boards, and this is one that really works and really makes a difference and has focus and impact. So for me, I'm passionate because this is a true win-win situation. Donors, who are largely dental manufacturers, distributors, service providers, et cetera, they can have a large impact on America's health. This also generates increased focus and demand for professional oral health care and home care. And so our products and our services, the things that we're providing to the market and the industry, there's going to be an increased demand for them. And that's not why we're doing it, but it's one of the things that we can point to and say, look, this helps the American people. This helps the healthcare provider. Dentistry is net a gain for us as the country. The more we invest in professional oral health care, getting patients to have better preventive care, appropriate restorative care, emergency care, surgical care when needed, the better their health outcomes would be. We will save money by promoting oral health care. So our money that we put into this as companies and as individuals not only gets multiplied by other givers through the grant program and through the work of our amazing scholarship recipients, but it's something that will also generate a positive return for our healthcare economy in total, and people will be healthier and happier, less mouth pain. What I would say, though, is I do want to see us make a leap ahead, not only in funding the pilot programs as we've done for years, but also with new initiatives. And I mentioned the pivot that we'll make on COVID-19, and that's still evolving. But so, we know this in the industry and we know this in the marketplace, but the mouth is not only part of the body, but it's an incredibly important part of the body. This is where we get our nutrition, express ourselves, we get taste and flavor and focal points of the face for nonverbal communication. People with great smiles, they get a different response from the people they're talking to. They feel better about themselves. Our breath flows through our mouth during exercise and heavy breathing. This is one of the key areas of the body that, we can have such an impact on people's overall health, their view of themselves, their emotional state, not to mention the basics of just having pain-free life and great nutrition for the balance of their life. So, I really do just feel like the foundation can have a massive impact in helping people think differently about oral health care and providing people with access to tremendous professional oral health care.
Well said, and thank you so much. And thank you for taking the time to speak with us, and thank you for all that you do for us and oral health care for so many people out there.